Welcome, everybody. Good evening and good morning to those of you who are taking the time to join us today. We say thank you. Pardon me. We are grateful that you have put us on your calendar and joining us for this incredible webinar opportunity that we're able to present today. Before we get started, I just wanted to go ahead and share a little bit about the Global Rural Nursing Virtual Collaboration Learning Grant. This webinar today is the first in a series of 4 webinars where our grant recipients from the previous year are going to share their final outcomes. These are always wonderful ways for us to learn what different universities are doing to engage their students in an international collaboration. And they're also really great ways for people who might be interested in applying for a grant in the following year to learn a little bit more about the opportunity. For those of you that may not be familiar with the Global Rural Nursing Virtual Collaboration Learning Grant, it is a grant funded by the MHCH Foundation to provide funding for programs that promote collaboration, learning, and global connections. The grant opportunity is designed to foster partnerships between international nursing students and educators who collaborate on rural community health projects. For anyone who might be interested in learning more, you can visit our website. The grant application period for the 2024-2025 grant will open on March 1. We are hosting a pre-application session on February 21st at 9 a.m. and again at 3 p.m. Central Time, where we're going to share best practices for writing a compelling application, tips for student engagement and involvement, ways to receive additional funding if there are technological issues in your country, and how to find an international partner. So it's going to be very informative. If you're thinking about joining, we recommend that session. Just a little bit of housekeeping before we get started as well. We are going to hold all questions and answers till the end so as to not interrupt the flow of our presenters. Of course, you may feel free to use the chat or Q&A feature on your Zoom panel at any time so you don't forget your question. I would love to introduce our presenters today. We have with us Aris Kendall Bungabong. Aris is currently the Dean of Nursing at St. Anthony's College in the Philippines. He holds a master's degree in nursing and is a candidate for a PhD in nursing science. Leading various nursing organizations, Aris actively contributes to international nursing initiatives and represents the Philippines on a global basis. Gibran is an assistant professor at the University of New Hampshire in Durham, New Hampshire in the United States. His recent research focuses on factors of the built and social environment that intersects with mental health and the physiological stress response. He is developing interventions using green spaces to promote resilience among vulnerable populations to climate change. And now I would like to turn it over to our presenters as they share with you their presentation today. You should be able to screen share, Aris, if you have, there we go.
Hello, everyone. Good morning from the Philippines. And today we will be sharing with you the outcome of our project, the collaborative online international learning focus on climate change impacts on rural nursing among students in the Philippines and in the United States. And with me is Gibran.
Good afternoon, good morning, good evening to everyone. We're glad to be here with you.
So to start with, we'll have a brief background of our respective institution. Gibran.
University of New Hampshire is a land-grant university in the state of New Hampshire. It is the flagship of the University of New Hampshire system. There's about 15,000 students. We have roughly 1,000 students in all of the nursing program. No, I said that wrong. maybe 600. Sorry, I was overestimating. We have undergraduate program, we have a master's entry program, and then we also have doctor of nursing practice and so assistant nurse practitioner programs, nurse education. So working towards a PhD program. So big hopes.
For my part, I'm representing St. Anthony's College, a nursing school in the Philippines. St. Anthony's College is located in the province of Antique, in the central part of the Philippines. The Philippines being an archipelago, we've been impacted with climate change, no? And we have experienced some of the impacts of climate change, no, during the recent years. So St. Anthony's College is a Catholic educational institution, and as of the moment, we are offering nursing, the nursing program being the only health program in the province. So Antique is highly rural areas, with majority of the towns in lowland near the sea, and we have 2 towns in the upland area. So that's St. Anthony's College. Gibran, would you like to share the background of our project?
Yes, well, the how this all started was St. Anthony's College, as was indicated earlier, was looking for an opportunity to collaborate, and reached out to the Global Rural Nursing virtual collaboration program. And I had participated in a project the previous year, was part of a group that started a project with Green with a group I was a Peace Corps volunteer in Malawi, so I had some connections with people in Malawi, and so we developed a partnership the previous year. And so as I moved to a new university, people had carried on that relationship with Malawi, and we were partnered together, St. Anthony's College and the University of New Hampshire. We worked together to develop a project focusing on climate change. As Aris said, climate change is affecting the Philippines, it's affecting New Hampshire. We're having in New Hampshire very mild winters historically. There's a lot more rain in the winter, a lot less snow, and the temperatures aren't staying low. One of the things that we're seeing from a health standpoint is an increase in vector-borne diseases from tick disease, primarily Lyme disease. And New Hampshire is a primarily rural state. There are some metropolitan, there's maybe 1 or 2 metropolitan areas, but most of the state is really rural.
Yeah, to add with, I would like to thank Stacy and Jernen for connecting. Now, I saw the grant invitation poster, and I emailed Jernen if for possible institution wherein we can collaborate for the project last year. And I was able to connect with Gibrano, and the 2 of us, with some of the other faculty. We developed the proposal, and luckily we were granted approval. Gibran, would you like to share on this?
Sure. So our main focus was creating a collaborative learning environment, not only for the students, but also for the faculty. I think we all learned from each other. We all were engaged with each other, learning about each other individually and collectively as the 2 institutions. And that really fostered those relationships really laid the groundwork for everything that came through the project. There was a lot of opportunity to learn about what's going on. It was learning what was going on sort of in the abstract, talking about climate change as a whole, but then we would have there was events that happened that disrupted our work, both in the Philippines with that we'll highlight, that we'll discuss later, but typhoons and same thing we're talking about now, with the weather and disruptive weather. There was storms that knocked out power. So we were learning in the real time what was going on with each other, what was facing the challenges that were facing our communities. We also wanted to be able to increase the educational opportunity for students to be able to engage not only in education about climate change, but also, understanding the cultural relevancy, of what was happening, the differences between our two institutions. We were able to use the community pages. We have a community page on the website. And that was sort of the basis of our operations. We had in-person Zoom where we would get together. That was always challenging based on the time differences. We were a full 12 hours, well, 12 to 11, depending on the time of year apart, but that was challenging. But we would have discussions during those times that we did get together. We would break out into groups and do group work.
Yeah, thank you, Gabriel. The next slides now show to you some of the clips, or no, some of the pictures that we had during our series of Zooms. So just like what Gibran said, we utilize asynchronous and asynchronous online interactions. Synchronous using the Zoom, and for asynchronous using the GRN website. So we had some discussions, online discussions. We have some questions posted, and even the introductions were done there. Also, the content of the different modules and that we developed were also posted in the GRN website, including the recorded video for those students who were not able to join. And at the same time, as part of the project is the development and implementation of community health intervention targeting climate change resilience. And to ensure the improvement or the quality of the different programs that we had regular feedbacking using surveys and Zoom meetings with students and faculty. At the same time, also the faculty, we had sessions on how we can improve the next sessions that we will have with our students. So these are some of the Zoom meetings. We started with a get to know meeting wherein we match our students to the respective institutions, and then we group them to a breakout session so that they can interact and they can share some experiences and their interests. So this is sessions among the faculty. We had some brainstorming on the different contents that we need to develop and to discuss. And this is the synchronous sessions using the GRN website. So our students were very active in terms of posting the responses. Imran, would you like to share?
Yes, absolutely. So we did create some educational modules, sort of talking about culture and healthcare, right? So we felt that was essential, given our global engagement, our engaging across time and space. And so we talked about different theoretical frameworks to think about culture. And also, I think one of the things that came out of that was the importance of understanding how culture shapes the way we interact with the environment. And if, from a nursing perspective, the environment is one of the 4 pillars of our profession. There's the human, there's the environment, there is health, and there's nursing, right? Those are the 4 pillars of our profession. And so the environment is very much, we often think about it at different scales. We can think about it in the environment of a room of a patient. We can think about it the environment of maybe a community, sort of the built environment, the social environment. We also used and highlighted a lens of planetary health, the health of the planet. The health of the planet has been suggested to be the source of human health and our civilization. And then also then bringing that together with climate and health. How is the climate affecting our health? How is, as you can see in the slide on the right, there's just different elements, respiratory, water quality, extreme weather, air quality, air pollution, things like that. So highlighting that with the students, and sort of helping them to make those connections.
So during these sessions, we would usually after the faculty now have discussed the topic or the content, we would usually assign certain students to breakout sessions so that they could answer some specific questions and they can interact with students from both institutions. So the faculty serves as moderators, no, to encourage discussions among the smaller groups.
And I think the advantage of that was a lot of times the students would not want to talk when it was a large group, but when it got a little bit smaller, a little bit more intimate, they were more engaged with each other. So that was a real a bonus.
At the same time, we utilize the Churn website now for our asynchronous discussions. So every after sessions for a content or a module, Gibran would usually post questions, and students, they would provide the responses, given that for every sessions, we only have a maximum of 1 hour length of time. So to follow this up, no, and for some students who would like to share also their ideas, they can post it in the website, and the other students can also read and they can also comment and give some responses.
The additional advantage of having content, the asynchronous content in the green as well was for students who had connectivity issues, students who, their internet might not have been stable the whole time, so they might have missed conversation. We'd always record the sessions, they could follow up there, and then also still get engaged if they were less inclined to do so in a more real-time experience. If they could think about it a little bit longer and more in depth.
At the same time, for us here in St. Anthony's College, we also held some face-to-face sessions. Within we gather our student participants for some discussions about the modules that were discussed. Gibran, would you like to discuss on the outcomes?
Really, I think the most powerful thing was the relationships that were developed, both amongst faculty and students, helping to understand each other, being engaged at that intimate level. There was also, we were able to come up with, the students were able to come up with projects. In the Philippines, there's some pictures coming up of some really amazing engagement that they did. And thinking about their practice, right? So thinking about as they go forward with their careers, how to engage their communities in conversations around culture or about climate change. Having conversations with somebody who, for example, who maybe is working outside and it's hotter. There's, they're not getting rest at night because it's, the temperatures at night are not dropping in a lot of places where they used to. And so, what are the health threats of that? Specific to New Hampshire, with with the tick-borne diseases, including Lyme, like making sure you're doing tick checks every day if you're outside in the woods, even in the winter, right? It used to not be a problem in the winter. Now it's more increasingly a problem. So again, building a deeper understanding amongst the students and the faculty, everybody, we learn from each other throughout this process. And then also with that specific focus on rural communities. There are certainly challenges that are unique to rural populations, especially given the low resource often that is associated with rural communities. They may not have the ability to respond to at a community level. They individually, there's oftentimes in the United States, there's a lot of, from a US standpoint, there tends to be a lot of individualism. And so being able to understand that desire, that cultural desire, while addressing these challenges with climate change, it's important to look at this holistically.
Yeah, well said, Gibran. One of the community intervention that was conducted by our students here in the Philippines is during when the project was ongoing. So we have extreme weather and it's very hot here. So as part of the topics on the impacts of climate change and health, so our students conducted a community health lectures on heat stroke and other summer diseases. So we selected a rural community, and the students shared some of their learnings from the different sessions that we had. And at the same time, they conducted blood pressure monitoring. They assessed residents' health status and provided them with appropriate health advice, referrals, and if needed. It was a very fruitful activity, and a lot of our students enjoyed the outcome. So for the challenges, yes, Gibran.
Please carry on.
So for the challenges, one of which is really on the time zones, given that the Philippines and the US, we are in 11 to 12 hours difference. So it's a good thing that we were given the option to first choose an appropriate time, given the difficulty in terms of connectivity. So we opted that we will have the sessions in the morning here in the Philippines, because we wanted that our students can arrive here in school, given that many of them have challenges in terms of connectivity. So they cannot have good internet connection, given that some are staying in places wherein there's no connectivity. So we usually would meet here in the Philippines at around 8 a.m. And that is 12 hours difference in the US. And at the same time, we had also some sessions wherein we have to postpone due to some extreme weathers in the Philippines. So there was an instance wherein we were greatly affected by a typhoon, and we have no electricity. And even the province of Antique was, because of the destructions of some of the beaches, there were suspensions of classes. So we cannot have our students come to school or even to have connectivity. So it's a good thing that our sessions are flexible, and we also utilize the Journey website for synchronous sessions. Ibran?
And we had winter storms, power outages, and in UNH, it was Sunday night was when our sessions happened, which is when a lot of students are preparing for the week. So that was a challenge. The late Sunday night, when students had clinical and classes the next day. Also, our students it was completely volunteer, and it was not in part of any class. So the students that we did have engaged did not receive course credit, and it was not part of their regular clinical hours. It was I think that would have been a real advantage if we hadn't been able to weave that together, but that was it was due to myself being a new faculty at UNH and not having the authority for those classes. At the time, I wasn't teaching the public health class. Now I'm teaching the public health class. So different circumstances might have resulted in different engagement with the UNH students, but the ones who were steady and really enjoyed it and got a lot out of it.
For us here in St. Anthony's College, we had a good engagement of our students since we selected third-year students. And although in the first series of sessions that we had, we weren't able to arrange some of their schedules. So we have students who are in clinicals and they're trying to join, but later on we tried to arrange, with the clinical instructors handling them so that they can be given 1 hour to join the sessions, that they can participate. The students will have to go here to school so they can participate in the session, and after which they can proceed to the clinical area for the related learning experience. For the student feedbacks, our students here in the Philippines really appreciate the opportunity to learn from our colleagues from the University of New Hampshire, at the same time to interact with students. So understanding the different the impact of cultural humility, and at the same time having a greater knowledge about the environmental impact of climate change. So a lot of the learnings that were taken from the different sessions were integrated in the related learning experience of the students, and even up to this time, planetary health and climate change are given priority in terms of the development of the projects of the nursing program. So we'll still have a series. Now moving ahead, we'll still have a series of activities, webinars to conducting, so as to provide awareness to residents, and at the same time to nurses, for climate change to be given importance in terms of healthcare. Gibran, would you like to add something?
I would just also say that I think that oftentimes the media tends to focus on more urban areas that are affected, and we don't always really see the full picture of how rural areas are impacted by climate change. Yeah.
Okay, I think that would be all for our presentation. So thank you everyone for listening.
Thank you so much for your presentation today. That was it was a great understanding of how your universities collaborated and how your project came together. I'd love to open this up for questions if anybody has something that they would like to ask, either about the outcome or the collaboration. As you're thinking about anything that you might want to share, I would like to invite you to join our next series. We have another webinar that is going to be, pardon me, on Tuesday, which is January 16th at 3 p.m. Central. So it may be the 17th for some people on the call today. And that is going to focus on a United States-Australia collaboration with undergraduate students where they focused on rural nursing opportunities. Also on January 25th at 8 a.m. Central, we are going to have our next group talk about Global Nursing Education Health Literacy Project. And that is with the University of Alabama in the United States and a university in East Africa. So please feel free to drop into those if you want to see how more of our groups came together. I do have a question from Audrey Snyder. She's asking if you could share a little bit more on how you developed your budget.
As part of the grant application requirement, we were required to present a budget proposal for the grant. So part of which included on the provisions of for us here in the Philippines, now we incentivize our students by providing them some materials for the conduct of the activity. At the same time, during the community interventions, we provided snacks to the participants. At the same time, transportation, and at the same time, we allotted certain budgets for the development of the course materials. At the same time, also to disseminate the project. So we included certain amount for presentation. So actually, we will have a series of presentations in some conferences, wherein we will be sharing the outcome of the program.
Thank you.
Along the same lines, we also made similar budget requests, and then also as Aris was highlighting, as far as dissemination, we included some funds to engage in a conference and do a presentation. Initially, the plan was for students to attend, but they have declined to do that. I'll be representing the project at, or we've submitted an abstract at a presentation. We haven't heard back yet, so hopefully we've got our fingers crossed for that.
Well, we hope that you keep us posted on that and share your outcome, because I mean, I think that we're all confident that this will move forward. So please do circle back with us and share how things go with that once it's put together. Okay, well, if there are no other questions right now, I just again want to thank everyone. It's always a pleasure to have you budget us into your time today. If there are any questions that come up afterwards, sometimes that does happen, please feel free to connect with us at GRNEN, info@grnen.org. We can connect you with our presenters today. You can also feel free to leverage the open forum on our website. Both of our presenters are active participants and would be more than happy to connect with you. And we will certainly be posting this in the event that you want to share this with other people in your peer group, your students, for advanced learning opportunities on demand. So thank you so much. We are so grateful, Jabran and Aris. It's been a pleasure working with you the past year. Appreciate your time today. I know it's early, I know it's late. So thank you. Have a great night. Take care now.
Thank you, everyone.
Thank you.